Mr. President, I rise 53 years ago this week. President Johnson signed the Medicare bill. I believe one of the most important pieces of legislation signed in the last 100 years. It finally removed from the shoulders of the senior citizens of this country the burden, the stress, the cost, the anxiety of not knowing whether they were going to be able to pay for health care, for hospitalization, for doctor's visits, and then later for prescription drugs. I want to talk a moment about two things. Number one, what it has done to our economy, and particularly the economy involving seniors. This is a pretty graphic representation that in 1965, when Medicare was passed, a third of senior citizens in the country lived in poverty. 1/3 lived in poverty and in fear of losing everything if they were stricken by a health catastrophe or even a minor health problem that they could not deal with. Over the next 53 years, this line comes down to 9.3% of seniors living in poverty. It has declined by 2/3, largely because of Medicare, largely because the financial burden of health care costs has been eliminated from their shoulders. Now, Medicare isn't perfect. There are things that we can do to strengthen it, to improve it. I think one of the things we need to do is to talk about high drug prices and the effect on seniors under Medicare. We also have to talk about prevention. One of the faults, I believe, with Medicare is that it only pays for medical procedures. It doesn't pay to prevent medical procedures. The cheapest operation is the one that you don't have to have. And I believe that's one of the areas where we can improve Medicare to provide more preventive services that will lower the cost for seniors, for the taxpayers, and for the whole economy. But even though Medicare, I would argue, is one of the most successful programs this body, this government, this country has ever adopted, but as I stand here today, there are people in this Congress who are essentially talking about scrapping it. And they use all kinds of fancy language about premium support and those kinds of things. They don't want to really do away with Medicare. Make no mistake. Premium support equals vouchers, and vouchers equals the end of Medicare as we know it. This is a horrible, no good, rotten, lousy idea, and we shouldn't do it. It will decline, it will diminish the support for the program, and ultimately put the burden back on seniors for paying the cost of their health care. And this whole idea of vouchers, who, when they're 85 or 90 years old, wants to sort through 10 different insurance policies, compare deductibles and co-pays, and try to figure it all out? I don't think that's practical. I think it's a cruel joke on our seniors. As long as I'm here, I'm going to do everything I can to call out this idea for what it is: a cruel swipe at the protection for seniors that Medicare has provided. We're talking now, I had a roundtable with seniors in Maine just this week, talking about prescription drug prices, but also about Medicare. And one of the things I learned is that one of the most important programs under Medicare is called the SHIP program, State Health Insurance Assistance, where people help seniors sort through what is still a fairly complex process of signing up and determining Medicare coverage. That's been cut 20% in the last 2 years. One of the things that came out of our roundtable was that what we need as much or more than anything else is information and guidance and care and concern, and the SHIP program provides that. And to be cutting that at this moment, again, is just inexplicable, and ultimately, I feel, is cruel. Now is not the time to be making cuts in Medicare. Now is the time to be strengthening it, to be providing for the future, to be providing for those citizens that are coming up. I know people in Maine who can't wait to be 65 because they will be covered by Medicare. I suppose they would just as soon not be 65, but they genuinely are waiting for a time when the burden of health care expenses is lifted from them, at least insofar as Medicare can do so. Yes, it needs improvement. Yes, we should do more about prevention. Yes, we should do more about the cost of prescription drugs. But fundamentally, this is an important program that is so essential to the lives of seniors across the country and the 200,000 Medicare patients in the state of Maine. This is an important anniversary, Mr. President. It's one that has really shown an incredible change. If anything has shown a successful track record, it's Medicare. And I'm certainly going to do everything I can for my time here to make sure it maintains itself as a bulwark against the risk of medical catastrophe for our seniors. We can do that, Mr. President, and we shall do it.